Hello and welcome to Public Report. I'm Jackie Kahlhamer, your host. Today our guests are Barbara Armstrong. She is the Executive Director of Prevent Blindness Wisconsin. And also with us today is Dr. Dennis Hahn. He is the Professor of Ophthalmology at the Medical College of Wisconsin. Our issue is health and our topic is diabetic eye disease. Oh, I'd like to thank you both very much for being our guests today.
Thanks.
You're welcome.
Thanks for having us.
Okay. So Barbara, could you first tell us about yourself and your work with Prevent Blindness Wisconsin?
Well, I serve as the Executive Director of Prevent Blindness Wisconsin. We're a nonprofit health agency that has been in existence since 1958. We were started by civic leaders in Milwaukee. And since then, we have provided free vision screenings and vision health education to the public. Each year we screen about 200,000 children in the state of Wisconsin to help ensure that they have healthy vision for school success. And we also help adults to be aware of the risks of eye disease and how to protect their healthy vision.
So could you also just give us an overview of the mission of Prevent Blindness?
Our mission is to prevent blindness and preserve sight.
Okay.
So we're completely in the prevention mode in terms of providing screenings, health education information. We also provide vouchers for care for low-income children and families. So if a person needs an eye exam or glasses and they are low income and they meet the requirements, we can provide a voucher for them.
Okay, and Dr. Hahn, could you please tell us about yourself and your work?
Yes, I'm Professor of Ophthalmology at the Medical College of Wisconsin, and I concentrate on retinal diseases, and diabetic retinopathy is one of them.
Okay. Now, can you tell us what is diabetic eye disease?
Diabetic eye disease is a condition where the retina becomes damaged from high blood sugar levels over time. And what happens is the high blood sugar levels causes damage to the smallest blood vessels in the retina, the capillaries. And over time, those capillaries can become leaky and cause swelling in the retina and vision loss. The capillaries can also close off, and that deprives the retina of needed oxygen, and then abnormal blood vessels form that result in scar tissue and bleeding, and that also causes vision loss.
So have you been seeing an increase in this?
Yes, we have. There have been more and more people becoming diabetic over time, and there has been a steady increase.
Now, is there a cure for this?
Once diabetic retinopathy starts, there is not a possible way to reverse it, but it can be slowed down or stopped. And the best way to do that, really, is to control the blood sugar levels.
Now, can you tell us how important it is for diabetics to have eye checkups and eye care and have their hemoglobin A1C levels checked?
It's very, very important. And the reason is that some of these abnormalities that develop in the retina do so without causing any symptoms whatsoever. And by the time they do cause symptoms, the damage can be quite severe and then becomes more of an attempt at trying to salvage what vision that they do have. And we do have a number of treatments that are available that can help to stabilize things such as laser treatments, injections of medications into the eye. And these are very successful, and in some instances we may need to do surgery to save the vision. The next important thing is that in addition to controlling the blood sugar levels is to seek attention with a dilated eye examination very regularly. That way these things can be checked.
Now, when you say very regularly, what are you considering that to be?
Well, for somebody who has been newly diagnosed or recently diagnosed to have diabetes and who do not have yet retinal problems, they should be checked at least on an annual basis.
Okay. Can you tell us why continuing education about diabetic eye disease is so important?
Well, Prevent Blindness Wisconsin is actually having a special focus on continuing education because, as Dr. Hahn has pointed out, there are sometimes no symptoms of diabetic retinopathy, and so damage can occur. Whereas if you get some prevention and you take the simple steps you need to take, you can avoid vision loss. So we're doing both public education. What we'd like to do is for the public, first of all, to be aware that diabetic eye disease is the leading cause of blindness among adults aged 20 to 74. So it's a significant problem. It's actually diabetic retinopathy has increased 89% over the last decade. So we really want people to know that. We want them to know that the longer you have diabetes, the greater your risk of diabetic retinopathy. And so, as Dr. Hahn has pointed out, there are some simple steps that diabetics can and should take to preserve their healthy vision. And the first is to get an annual dilated eye exam, minimally an annual exam. Your doctor may say you need to come in more often, so you should follow the recommendations of your eye care professional. We also want diabetics to know to control their A1C levels. As Dr. Hahn has described, the A1C is a good measure of the risk of complication due to diabetic eye disease. And so we want diabetics to work with their physician and shoot for a 7 or better if that's feasible for them. Dr. Hahn has, I think, mentioned that keeping that level at 7 or better really does significantly reduce your risk of diabetic retinopathy. And you may want to speak more about that too.
Yes, the hemoglobin A1C level is an indicator of how well your blood sugar has been controlled over the previous 3 months. And we know that if you keep that level at a relatively normal level, a common goal is 7 or less, that you can reduce your risk of vision loss considerably. And just the difference between a level of 7 and 8, for instance, can reduce your risk by almost half. So having good control and using that as an indicator can be very helpful in helping people preserve vision. And we sort of equate the daily blood sugars to like a baseball game. You have a good level, that's like winning a game. If you have a good A1C level, that's like the winning percentage for the season, and that gets you into the playoffs. And of course, the championship, of course, is saving your vision, and that's a doable thing.
Now, why must those who have diabetes take responsibility to protect their eyesight?
It's because they have the primary responsibility, usually, of checking their blood sugars and seeing their physician and taking the initiative to ask their doctor how best to control their blood sugar and making their appointments to see the eye doctor on a regular basis.
We also want to remind diabetics to adopt those healthy lifestyle habits. We call that Live Right, Save Sight. In fact, have a website that we'll be launching called liverightsavesight.org, where diabetics can go to get more information about diabetic eye disease. But as long as diabetics are adopting some of those healthy habits, eating right, exercising, controlling their blood sugars, quit smoking. If you do smoke, do quit smoking. That really has an impact on your healthy vision. Controlling your blood pressure. All those things together are really, as Dr. Hahn has said, within the diabetic's control. You're the only one who can manage that. And so we want to inform people that doing those things really does have a good impact on their healthy vision.
Now, are there specific questions that a diabetic might need to ask their eye doctor when they go and visit?
Yes, I think it'd be good for them to ask their doctor about their A1C level and what they can do to best control that, and whether that goal of 7 or less is achievable for them. And they can ask what kind of healthy lifestyle things that they can do to maximize their chances for saving vision.
Now, Barbara, are you also working on educating nurses in regard to healthy eye care?
Yes, we are. We actually will be launching a new program. Our first class will be November 15th of 2012. It is for nurses, diabetic educators, and other community health professionals, and they can learn more about that course on our website, liverightsavesight.org.
So is there a lot of new information coming out about how to better protect your eyesight?
Well, one of the newer treatments these days is the use of medicines to control diabetic retinopathy. We're finding more and more information about why these abnormal blood vessels form, how leakage occurs in the retina, how blood sugars damage the capillaries. And so the forefront really is the development of new medications that are available Currently, some of them involve injection into the eye. Believe it or not, we can really numb the eye so that you don't feel anything at all. The other are medications that may be given by mouth or other things that may be developed in the near future. So we're very optimistic that over time, things will become better and easier to control in terms of saving vision.
So generally, there aren't many symptoms before the eye disease has progressed?
Usually by the time symptoms have occurred, the condition is fairly well established in the eye. And if you can catch it before that happens, you can take the necessary measures to keep it from getting worse. And that is the principle behind getting frequent dilated eye examinations and controlling the blood sugar levels.
Would you say definitely prevention is the best way?
Prevention is the best. It is truly, an ounce of it is truly worth a pound of cure in this condition. And it's very doable.
And Barbara, why has Prevent Blindness Wisconsin taken on specifically addressing diabetic eye disease at this time?
Well, we have because there are so many diabetics in the state of Wisconsin. It is a public health issue. Diabetes is on the rise. We see now type 2 diabetes even among children, which was unheard of years ago. And so we see it as a really very important public health issue. Because of the increase in diabetic retinopathy, 89% over the last decade, we know that if prevention is not increased, if people do not contain their vision health, this is not only a public health issue, it becomes an economic issue as well. So something that we really want to have an impact upon and reduce diabetic retinopathy in our state.
Does this also affect those who have type 1 diabetes?
Absolutely. In fact, we've been, as part of our campaign to raise awareness, we've been interviewing diabetics who've had diabetic retinopathy to hear their stories. And so several of those have been, in fact, type 1 diabetics. Particularly difficult sometimes to help a teenager understand the implications of not managing their blood sugar. And so we have one young woman who, when she was in her mid-20s, began to experience the symptoms of diabetic retinopathy. And so she had been diabetic since she was 11 years old. How do you drive home to a teenager? What you do today can have a serious impact on your vision and your life for years to come. We hope that telling those stories will help to raise that awareness and motivate people to take action today to manage their lifestyles, manage their diabetes, and preserve their vision health.
So then there is hope for vision protection through prevention.
Indeed, there is.
Yeah.
Okay. Well, thank you both very much.
Thank you.
Thank you.
We've been speaking with Barbara Armstrong. She is the Executive Director of Prevent Blindness Wisconsin, and Dr. Dennis Hahn, Professor of Ophthalmology at the Medical College of Wisconsin. Our issue for this segment has been health, and our topic, diabetic eye disease. Thank you very much for watching Public Report.
The material on this program does not necessarily reflect the views of WWRS.